right, everyone. So we are here with a new webinar by Capline Healthcare Management. And today we are going to discuss the role of digital marketing when it comes to boosting your patient inflow. Now, before we move ahead, first things first, my name is Yasha Harshita, and I work as a digital marketing manager in Capline Healthcare Management. After a brief introduction, we'll begin with the webinar. So Capline, we are headquartered in Houston, Texas, and we work with more than 700 practices across 50 states. We have a highly skilled team that take care of revenue cycle management, credentialing, eligibility verification, insurance, patient interaction. We also provide IT support and staffing. And last but not the least, we take care of the digital marketing activities for all our practices. So coming back to the goal of today's presentation. So the goal of today's presentation is to discover the untapped potential of digital strategies for patient acquisition. We will also learn a few practical tactics to implement to your practice so that you get proven results. And we'll leave you with a roadmap so that you can increase and better your online presence and attract new patients. Now, before we move to the strategies, we would like to understand that have you ever faced challenges like, you feel overwhelmed or underbooked? You may choose to answer that. Do you ever feel that you're not able to reach out to your audiences, to your patients directly? Is it mostly a word of mouth working for you? Or is it, new patients are there? Are you feeling, overwhelmed by the complexities of online marketing? Like, do you find it really difficult to understand the whole digital marketing jargons and the platforms and the presence? Well, these are certain challenges which we have understood as we have spoken to a lot of our clients. They also go through similar issues and challenges. So in this webinar, we are going to address all of them and we are going to help you overcome all the challenges. So in order to understand the strategy and in order to fulfill all the goals, we need to understand that how the digital shift is there, how the patients are behaving on all the digital platforms. Now, the traditional marketing channels, if we see, there are like newspapers, billboards, phone books. These are declining over a period of time. And around 97% of our customers are online. They search everything online. They have their own digital individual profiles and presence, and they look for all the answers on the web. So a strong digital presence is definitely the need of the hour for even the healthcare practices. Because when we look at our patients, they search for everything online, right from their symptoms to the solutions to the doctor nearest to them. So they're searching everything online. So when we see this digital shift, we feel that digital marketing offers a targeted, a measurable, and a very cost-effective way to reach out to your ideal patients. You'll be amazed to know that total number of monthly visitors on Google, if you see, there are around 85 billion of them. And out of that, unique visitors related to healthcare, if we see, there are around 2.4 billion, which is a huge, huge number and certainly cannot be ignored. Followed by that, we have YouTube, and then we have the social media channels. Now, a quick run through of how this universe works, how the entire marketing, the shift from traditional versus digital has happened. So if we see, traditional marketing has a local reach. A newspaper might reach a household, might get into the hands of 4 to 5 people. But when you say digital has a much, much larger reach. The targeting is very broad when it comes to traditional marketing. So if you are targeting a patient, say, which is slightly of a higher age group, with a newspaper, you might reach the person, you might not reach the person. But with digital marketing, you do precise and personalized targeting. You reach that exact individual, the exact age group you want to meet. The measurement for traditional marketing, again, it is very difficult to track because you don't really know that how many pamphlets or brochures or newspapers have been read by how many people. Of course, you do have a readership number, but real-time insights and detailed analytics are provided by digital marketing efforts only. Now, coming to engagement, traditional is always a one-way communication. We see a TV ad, we read a newspaper, and then it is done. It becomes a part of the memory. But digital is definitely a two-way interaction. We are able to engage with our target audiences. We are able to talk to our patients in real time. Traditional is often expensive, whereas in digital, you have more cost-effective options. Like we have discussed, newspaper ads, billboards, direct mail are all traditional. And when it comes to digital, it is all website, SEO, PPC, social media, content marketing, email, and a lot more. Now, if we see, we have a digital roadmap for you. You need to understand that how the patients or any user is, its journey on social media. So, uh, talking strictly about patients, they research everything about their health regarding, they have a habit of Googling it. They have a habit of going on social media. They have a habit of referring to mostly blogs, articles, and, things like that before actually reaching to a practice. So our idea is to reach out to them, to talk to them while they are doing this search. So if you see the journey, at first patient searches, researches about their health concerns on social engines. They search and they figure out. While their search, they go through all the, you get options, you get healthcare provider options, you get options, you get information from Google that, if you're searching a doctor near me, you'll get all the results in the search engine. Then you make up your mind, you figure out that out of all the search results that you have got, patients choose a provider. They figure out, they book an appointment, they finally interact with the practice, they go, they visit, and eventually, if they feel good, if there is a positive review, they refer you to their friends and family as well. So this is how the journey has been. Coming to how we can access and get into the user journey while they are trying to search and communicate with us. So we have a toolbox. We have something like, you can call it essentials of digital marketing, that these are the 8 things that you definitely need to have. Like these 7, 8 things you definitely need to have. So what tools do we have? Before I move ahead, I would like to thank you all of you for joining the webinar once again. And do let me know if any of you are using, or you have a website, or are using an SEO service, or are trying to look forward to a PPC activity, or are you availing any kind of social media service or content marketing. I would take a second or two here to, if any of you is currently involved in any such marketing activities, you can just maybe raise your hand and let us know. So coming back to the digital marketing tools, the offerings that we definitely need to have a website. It is your digital showcase basically. Then you definitely need to have an SEO. SEO is search engine optimization, which is very, very crucial when it comes to local search. Then we have something called as a PPC. PPC is pay per click. These are the ads that we talk about. These are the ads that everybody talks about. Ads on Google, ads on Facebook, ads on Instagram. So these are the ones that are collectively called as PPC, which generate you direct leads. Leads means new patients. Then we come to social media. This is again a very crucial space to be in, because uh, we have all sorts of patients. We have the elderly, we have the millennials, we have the Gen Z. So if you want to actually reach out to all of them, especially the Gen Z, this is the place to be. And this is also a very fun place. Like you can interact, you can talk, you can engage with them, you can be candid about your services. Coming to content marketing, of course, a certain level of education is required. And you also need to engage in a most interactive and a most amazing manner with your patients. And little creativity definitely goes a long way. So we apply content marketing. Then coming to email marketing is the oldest method in the book, and it always works. So we can't steer away from it. And last but not the least, online reputation management. This is one of the most mandatory things to do right now, because any patient right now who wants to come to your practice, who wants to book an appointment with you, will definitely go and read your online reviews. Now we'll explain all the uh, tools in details. So to start with, we have the website. Now this is the first impression, the potential patients get you. So you need to have a great website. Like, even it's not about having a complex website, but it's about having a one page, or even, a solid online presence, because, and also it has to be very responsive. By responsive, I say it should be mobile friendly, because around 97%, 97.6% of the population accesses everything using smartphones. So if you have a smartphone, you are definitely accessing and Googling everything online. So definitely you need to have something responsive in place so that people are able to view you better. And it definitely makes it easy also. Coming to SEO, SEO is, you can say that it aids the website. It helps the website. It helps in the local search. It is like a secret weapon. So the moment somebody is searching you online, they come across your website, like Google prefers your website or your business profile before anybody else's, if you have a solid SEO in place. Because this is one area, this is one tool which is very, very beneficial in getting you new patients. It does take time. It is a gradual process, we would say, but it is a very effective one. So I have a quick example here for all of you. So if you search something like doctor near me, these are like 3 keywords. Doctor near me. You are searching for a doctor. The location is near you. Google automatically picks up your location and gives you these options. So the very first option is a sponsored one, which is basically an ad. So ZocDoc, the company here, is running an ad right now. So because you have written doctor near me, and the ad has keywords like doctor, near, if you can see, then this ad is on top of the search, and it is showing you right now. Followed by that, it gives you places. It gives you the nearest place that you are in. So when I searched, I was given these options, these top 3 options, and there are more, with their timings, with their websites, with their direction, with their calls, each and every detail. So like we discussed, we need to have a website in place and we need to equip it with SEO. This is how local search works. Followed by this, Google, being very intelligent, of course, it also gives us related searches, because it understands that sometimes, maybe you're not typing the right keywords, or maybe it just helps you, it aids you to find, to search better, to find better options. So for example, related searches, it tells you that, a family doctor near me, or a doctor near me which is open now. See the timings. So whatever you enter on your website, whatever information you furnish there, Google uses it to your advantage, and it actually gives great results. So this is like how search works. Coming back to another very important and mandatory component, that is the PPC, pay-per-click. This is an area which not many people like to explore at first, but it gives short results, and you get noticed right away. By right away, I mean that in the previous slide we just discussed that, the top portion of the search is dedicated to sponsored ads. So if your ad is perfect and the bid is proper, you are definitely there in the top search results if somebody is searching for you, or if somebody is searching for something similar. So we have an example for you here. For example, see, once you search doctor near me, they give you ads like this. So the moment it is written sponsored, it means an ad. So this ad talks about urgent and primary care, and it has, it closes to 8 p.m. So maybe when I was searching for it, I was around 6 p.m. or so. So it gave me this because it was still open. So this is how ad works. And the best part about ads is that you can always experiment. You can try, you can experiment, you can create shorter ads, you can use multiple, you can create a directional ad, you can create a link-based ad, a referral ad, lots of multiple options there. And the beauty of it is that you can actually do a hit and trial and come to what works best for you. Coming to the most engaging space that is the social media marketing space. This is the space where people enjoy themselves. They talk about they talk about each and everything. Earlier, it started off as a family and a friends thing, but then now it knows no boundaries, and it has become a very powerful tool for building relationships and community. So if and the best part is that there is a lot of information sharing happening real time right now. So people answer questions, they run contests, they engage with their patients. They also share a glimpse of how the practice is actually is. Say, how the doctor is, what are the thoughts, how people are interacting with the practice. For example, if I want to create a reel for a practice, and I could easily, showcase the interiors and show them and tell them that, how welcoming and how safe and how amazing this journey has been. Probably social media is the place where I will create a reel for you. So you can choose platforms from Facebook, Instagram, X, LinkedIn, others, and whatever works the best for you. Out of these, Facebook and Instagram, yes, definitely are mandatory. And LinkedIn also can be used to your advantage for constructive communication. Coming to content marketing, educating and empowering patients. So, uh, information sharing is one thing, but sharing it in the most creative manner possible is what we excel in it. So you can share them as infographics, you can share them as articles, videos, blog posts, and whatnot. You can position yourself accordingly. And this is more about thought leadership. This is more about being an expert. This is more about building your trust with people. Because when you publish content on a regular basis, when you educate and when you empower your patients, they genuinely trust you, and there is no getting back from there. They're just there with you all the time. And then you get a lot of referrals also, and you build relationship and community out of this. Coming back to email marketing. Now, email marketing still till date around 49.5% of people in the US, they actively use email apps. So we can definitely not refrain from using email marketing. And this is also a direct line to the patients. You can create a nice emailer which is informative, which is to the point. You can also talk about special offers and practice updates, and you can share it with your patients. This also works as a topical reminder, like every occasion, say Independence Day is just around the corner, and you can talk on Halloween, you can talk on Easter, you can cover all the topical days, and take your email marketing to the next level. Coming to the last but one of the most important things, online reputation management. Online reputation management is basically a new word of mouth. So normally when a person searches for a doctor near them or for a practice, they end up reading the reviews, or rather I would say they prefer reading the reviews first before booking an appointment or before reaching the practice. So online reputation management becomes very, very, very important for us, because if it is positive, then great. Then we acknowledge and then we say that, hey, amazing, thank you for your valuable feedback. But if it is negative, then also we have to acknowledge. And by acknowledging, we show that we care. So in both the cases, it becomes very, very imperative for us to be to have online reputation management, which again, Capline is uh, amazingly well at it. And we can share some examples with you. Before we share the example, I have a very interesting case study for all of you. So there was a family dentistry that was seeking remarkable growth in patient inflow with digital marketing. So they said that they have tried everything. They have seen a slight increase in whatever marketing efforts they were doing. The traditional practices and things like that, the word of mouth, the pamphlets, the occasional emailers, things like that. But they wanted they wanted a robust strategy which can get them regular new patients and help them build a better digital presence. So we came up with a strategy where we suggested them a local SEO. We said that, you have a great website, there is content, but you need to equip it with SEO. So we built a Google business profile for them, and we upped their SEO game. Then we suggested them Google Ads. The budget was not that great initially, but we built on it and we gave them amazing results. Around 220% ROI in 3 months is just amazing for a local practice which is out there. So that happened. And then social media marketing as a longer strategy where they can keep on engaging with their patients and they can keep on talking to them. They can often get more like better reviews and better referrals. And the interaction happens for a longer term, and eventually a community builds. So these were the three things that we suggested. And guess what? We have a report card for you to show where you can see the amazing results that are there. So we had around 250 phone calls per month. Phone calls like people calling from all over the place, everywhere, asking for booking appointments, taking sessions, even for smaller things, everybody was calling this family dentistry that we helped. So this is an amazing case study which we are really proud of, and we were really happy to head the family dentistry here. Moving on, like we said, reputation, online reputation management, it really works. And we definitely have some happy clients with us. And these were the testimonials earned by Capline Healthcare Management. And here are a few, it's like a glimpse of a few good ones that we have amongst the many. These are actual Google reviews, which we have received from our esteemed practices who have been our partners for really long. I think we had a great time here. At least I had a wonderful time interacting with you all. And thank you everyone for turning up for the webinar. You can reach us at these numbers and the email. You can simply dial 888-444-6041 or reach us at the email ID that is given here, thinkgrowth@caplineservices.com. And we are ready to partner with you and ready to help you boost your patient inflow. Thank you, everyone. Thank you so much for joining the webinar.